Have you ever come across the term grower versus shower? Would you say you're more of a grower or a shower? Today, I'm going to clearly explain what that means, and whether there's any scientific reasoning behind why someone may be one or the other. I'm Dr. Rena, a urologist and pelvic surgeon. If you're new to my channel, thank you for being here. I truly appreciate every one of you, and I hope you're learning a lot while enjoying your time as part of this community. So, what exactly does grower versus shower mean? A grower is someone whose penis noticeably increases in size when going from a flaccid state to an erect state, while a shower shows very little difference in length between those two states. So, why does this happen? It comes down partly to genetics and partly to environmental factors. Genetics are determined by your parents, and the traits pass down through your DNA. Things that are beyond your control and cannot be changed. These factors influence how elastic your tissue is, including how much collagen and flexible tissue are present in the penis. This can also shift over time, as some people may have greater flexibility and length when they're younger, which gradually decreases with age. The second part relates to environmental factors. So, if you're dealing with things like poor health, smoking, an unhealthy diet, or carrying a bit of extra weight, that can also impact how flexible your tissues are. In fact, being slightly overweight might make you feel more like a shower, because part of the erect penis may be less visible due to excess body fat, and it becomes more noticeable during an erection. Certain environmental factors can also influence how your penis appears. This includes things like room temperature, exposure to cold water, stress levels, or even when you're in the middle of exercising. In the end, this has nothing to do with your fertility, your masculinity, or your ability to satisfy your partner. So, has this been studied scientifically? Yes, it actually has. In one study, researchers looked at men with erectile dysfunction, 274 participants in total. Each of them received what's known as an intracavernosal injection, which is used to help produce an erection. The researchers then measured penile length in both the flaccid state and after the men were fully erect following the injection. They compared the difference between the two measurements and found that the average change was about 4 centimeters, or roughly 1.5 inches. They used this as a cutoff point. If the increase was more than 4 centimeters, you were classified as a grower, and if it was less than 4 centimeters, you were considered a shower. So, what did the results show? About 26%, just over a quarter of the participants, were identified as growers, with an average increase in length of around 5.3 centimeters. The remaining men were categorized as showers, with an average increase of about 3.1 centimeters. The researchers also looked for any factors that might predict whether someone would be a grower or a shower. Interestingly, they found that nothing really stood out except for age. Younger men were more likely to be growers and also tended to have a longer erect length compared to showers. It's important to remember that this was a relatively small study, involving fewer than 300 men, and it's the only research we currently have on this topic. So, what should you take away from all of this? First, you're definitely not alone. There are plenty of men in both categories. Second, there's no clear way to predict whether someone will be a grower or a shower. And importantly, this study only included men with erectile dysfunction, so the findings may not apply to everyone. At the end of the day, being a grower or a shower has no effect on erection firmness, performance, or your ability to satisfy your partner. The most important message is simple. Whether you're a grower or a shower, you're perfectly fine just the way you are. Focus on staying healthy, staying happy, and always taking care of yourself, because you truly matter.